Most people think strokes happen suddenly, without warning. But what if I told you, your body often starts whispering days, even weeks before it happens? And the scariest part? It usually shows up at night, when you're alone, and least likely to notice it. If you're over 60, this is something you cannot afford to ignore. Doctors have found that many seniors who suffer a stroke actually experienced subtle warning signs beforehand. But because these signs seem small, harmless, or temporary, they get ignored. Doctors have observed that many seniors who later suffer a stroke actually experienced subtle warning signs beforehand, but because these symptoms often feel mild, temporary, or easy to explain away, they are ignored in the moment and forgotten by the morning. In this video, you are going to learn about one of the most overlooked nighttime symptoms and understand why it could be your body's way of trying to protect you before something serious happens. The symptom often begins in a way that feels so ordinary that it does not immediately raise concern, because you might be lying in bed trying to fall asleep, or perhaps waking up briefly in the middle of the night, and then you suddenly notice a strange sensation somewhere in your body. It could feel like numbness, tingling, or a slight loss of sensation in your arm, your leg, or even your face. And at first, it does not seem painful or alarming enough to trigger panic, which is why most people assume it must be something minor. You might tell yourself that you simply slept in the wrong position, or that your circulation was temporarily affected, and with that assumption, you adjust your posture, shake it off, and go back to sleep without giving it another thought. However, what most people do not realize is that this exact experience could be something far more serious, something known as a transient ischemic attack, which is often referred to as a mini-stroke, and it is one of the clearest early warning signs that a major stroke could occur in the near future. A mini-stroke happens when blood flow to a part of the brain is temporarily reduced or blocked, and even though the interruption may only last for a short period of time, it can still affect how your brain communicates with your body during that moment. What makes this especially dangerous is the fact that the symptoms can disappear completely within minutes, which creates a false sense of relief and leads people to believe that everything has returned to normal, when in reality, their body has just issued a critical warning. To understand how easily this can be overlooked, consider a situation that happens more often than many people realize. Imagine a man in his late 60s who wakes up in the middle of the night and notices that his arm feels unusual, not painful, but slightly numb and unfamiliar, as though it does not fully belong to him in that moment. He shakes it gently, thinking he must have slept on it the wrong way, and within a few minutes, the sensation fades, allowing him to relax and fall back asleep without concern. The next morning, he wakes up feeling completely fine, goes about his normal routine, and never gives that moment another thought, because it did not seem important at the time. But just 2 days later, he experiences a full stroke, and when doctors later ask if he noticed anything unusual before it happened, the only thing he can remember is that brief moment during the night when his arm felt numb. That moment, which seemed so small and harmless, was actually his body's way of warning him that something was wrong. Nighttime can make these symptoms more noticeable and sometimes more dangerous because the body naturally slows down during sleep, which affects heart rate, blood pressure, and overall circulation. When these systems shift, certain underlying issues may become more apparent, especially in individuals who already have risk factors such as high blood pressure, diabetes, or poor circulation. The numbness or tingling you experience at night is not always the only warning sign. because it can sometimes be accompanied by other subtle symptoms that are easy to overlook if you are not paying close attention. You might feel a sudden wave of dizziness when getting out of bed, or notice that your vision seems slightly blurred or dim in one eye, or even experience a brief moment where your speech feels off or harder to control than usual. Some people describe a strange heaviness on one side of their body, almost as if one arm or leg is more difficult to move, even though the feeling passes quickly and does not leave a lasting impression. Because these symptoms often disappear within a short period of time, they are frequently dismissed as unimportant, but they should never be ignored, especially when they occur together or repeatedly. Many stroke survivors share a similar reflection after their experience, explaining that they felt something was not quite right beforehand, but chose to ignore it because it did not seem serious at the time. They did not want to overreact or assume the worst, and since the symptoms faded, they convinced themselves that everything was fine, at least until the moment when things suddenly changed. If you ever notice these kinds of symptoms, particularly during the night, it is important to take them seriously and not wait until morning to seek help, because time plays a critical role when it comes to preventing long-term damage. Acting quickly can help protect your brain, preserve your mobility, and maintain your independence, which is why immediate action is always the safest choice. 3 are simple things you can do daily to reduce your risk. Keep your blood pressure in a healthy range. Stay physically active. Even light movement helps circulation. Eat foods that support heart and brain health. Drink enough water throughout the day. Manage stress and sleep properly. Keep track of your blood sugar. These habits may seem small on their own, but when practiced consistently, they can significantly lower your risk and help you stay stronger and healthier as you age. Your body communicates with you in subtle ways, especially during the quiet hours of the night. And learning to listen to those signals can make a meaningful difference in your health and your future. Sometimes, what feels like a minor inconvenience is actually an important message that should not be ignored, because in certain situations, that small signal may be the only warning you receive. If you found this information helpful, consider sharing it with someone you care about, because it could make a difference in their life as well.